Welcome back to our special 30-minute show here on the Dent Neurologic Institute. Many of us pass the building on Sheridan Drive and the 290 every day, but have little idea of the groundbreaking research and medicine that is practiced here. Did you know that Dent has the largest medical marijuana clinic in New York with nearly 7,000 patients? Well, I'm back with Medical Director Dr. Laszlo Mechtler here to talk about this therapy. Dr. Mechtler, you have offered this since 2016.
That is true. That's when it became legal in New York State in January of 2016. And in the meantime, we've seen close to 7,000 patients.
Who can benefit from medical marijuana, and what kind of conditions does it help improve?
So New York State, on their website, has the 13 indications which we can use to certify patients. But briefly, pain is the major issue. 70% of our patients are in some form of pain, but other neurological disorders, including MS, Parkinson's, ALS, neuropathy or spinal cord injury, even irritable bowel syndrome and other diseases such as HIV and cancer.
What ages can you treat with medical cannabis?
Well, it's not limited to age. In my practice, my youngest is 6 months old, and my oldest is 102. And we looked at all responses, and patients respond independent of the age.
This is not like getting high recreationally. This is something totally different.
The viewers have to understand that this is not about smoking. It is not about getting high. It's about getting quality of life, improvement of pain control. And in my experience, it does work for our patient population. That's why I enjoy, and I have to say, when I started, I was a skeptic. Now I'm a strong advocate.
Doctor, what is CBD?
The CBD is the medical component, which is an anti-inflammatory. It's a painkiller. It helps with anxiety and helps you sleep. Now, if I had a drug that helps with those four things, it would be the drug of the world.
And can you tell us who pays for this?
That's the unfortunate part. Payment is self-pay. It's cash pay to the dispensaries. Unfortunately, because it's a Schedule I drug, which means research cannot be done on it adequately, the payers are not paying for it. And until that's done, and hopefully we could be part of that process, patients have to pay out of their pocket. They pay about $115 to up to $500 a month.
For people who are hearing this for the first time, if they are suffering from any of those conditions and so many more that you'll find on the website, they're free to come and talk about this as a therapy for them.
That is correct. I like to see patients referred from the primary physician. On our website, you can download a form that's filled out by the primary doctor who explains the patient's symptoms. But when the patient comes to our clinic, the patient's completely evaluated, not just the history, not just the examination, but the diagnostic tests that have been done. So we become the patient's physician. It's somewhat different than elsewhere. So I really strongly feel that we need to know more about the patient. This has to be physician-controlled.
Thanks, Dr. Mechtler.
Thank you very much.
Now back here on the set, Steve Prisbala joins me. He is Dent's legal counsel and can answer additional questions that come up about medical marijuana. Welcome, Steve.
Welcome.
And I know you had two things that you definitely wanted to get across.
You know, two issues we really see with patients is, how does this affect my employment? That's the main issue. I'm taking marijuana now. Is this going to affect my job? And the answer is, it depends. If you're a federal employee, you can't take this. Federal law prohibits this. It's a Schedule I drug. If you're a state employee or county employee, they do allow this. Most companies in New York State have been very lenient and changed their policies in the past 2 or 3 years to allow people to use medical marijuana. You will need a note from your physician. We're happy to supply those notes. But this is going to show up on a pre-employment screening, a drug test that maybe is randomly given. So you want that note ready, and you want to understand your employer's policies vis-a-vis marijuana use and medical marijuana use going forward. The other thing we get asked a lot is, can I own a gun? And the short answer is no. There's a statute from 1968 that says if you use marijuana at all, you cannot be a gun owner. It's a federal statute. There's nothing in New York State that says you can't do it, and nothing in most states, but federal law really prohibits gun ownership, which is kind of strange because people who have been convicted of other crimes are still allowed to own weapons, but if you're using medical marijuana, you are suddenly excluded from gun ownership. So that's something we're working through our advocacy groups to kind of change and evolve the country's position on.
And you say that question comes up a lot. That's one I would have never guessed.
It does.
Yeah.
It really does. Yeah. I think our population is very diverse. It's both city dwellers, rural folks. People like their firearms, whether to hunt or recreationally,
right.
And it's a very important question.
Thank you, Steve. Listen, still ahead, information on a brain health event that you are invited to.